Top Bed Talk.
I'm honored to introduce our next speaker, Sarah Ruane. If I say it well, yeah, thank you, okay. Sarah is currently Sports England's national lead for health, and she led extensive transformation and investment programs in preventative health. So Sarah, please, the floor is yours.
Thank you very much for the kind invitation today. So I'm Sarah Ruane. I oversee the health and activity work of Sport England. Today I just wanted to talk through, or wanted to pose, moving as medicine. Is it the most underused but proven health promotion and healthcare practice? So just have that in the back of your mind. First of all, to set the scene a little bit of why Sport England are interested in this, this is really at the heart of our vision, which is that we want everybody in England, regardless of their age, level of ability, background, to feel able to engage in sport and physical activity. Some will be young, fit and talented, but most will not. We need a sports sector that welcomes everyone, meets their needs, treats them as individuals and values them as customers. So at the heart of this is our belief that people disproportionately impacted by the barriers of physical activity deserve an equal opportunity to take part and get the benefits being active can bring. The challenge that we face in England, however, is that a quarter of the population are currently inactive. So that means they're doing less than 30 minutes of moderate intensity physical activity per week. And there is also strong evidence that they're also not meeting the other CMO physical activity guidelines such as strength and balance. So when we put that into context, so that's 30 minutes is just 0.3% of a person's week. So we have a quarter of the population not meeting that 30, even getting to a 30-minute threshold, and even less meeting the CMO guidelines of 150 minutes of moderate intensity physical activity per week. Even more shocking is that the average of 25% is actually mass and very stark inequalities with subgroups of the population who are significantly less active than others. You're 2 times more likely to be inactive if you're over the age of 55 compared to if you're under. And an example here of those with a disability, so an impairment, or they've self-reported as having an illness or health condition, are also 2 times more likely to be inactive. So this speaks directly to our mission to address this injustice and transform sport and physical activity so people everywhere, regardless of their background, can benefit equally. So why does that matter? Why does that matter to our health in particular? Physical activity, as hopefully all of you guys know, plays an absolutely fundamental role in preventing and managing health conditions and improving our health and well-being. Low levels of physical activity or inactivity drives disease development, and that mechanism is in a diagram to the right, so it's from the Faculty of Sport and Exercise Medicine. It's been described as a best buy for public health. The CMO cites it as a miracle drug. So something isn't quite landing if we still have 25% of the population who are inactive. So why is it that the message that we're giving, or the evidence with such strong evidence to the left there, not being acted on a daily basis? Well, we have some big challenges to address. Social, cultural, organisational norms. So the first is for those, particularly those living with a health condition, feel like physical activity is so far removed from something that they want to do necessarily, or that sport and physical activity is normally the like lover, the person that's going to a sports club regularly. Their self-identity is so far removed from what an active person is. And we've conducted quite a lot of focus groups recently, and I'll explain why later. But this feeling of not being able, so not having the capability psychologically and physically, or that perceived capability, is a big barrier for these individuals, and not knowing what to do as well. Secondly, then, we have daily messages being given to us by the organisations that are then surrounding these individuals and ourselves, whether that's through the media, through healthcare professionals, through carers, family, friends, that aren't necessarily, again, landing. They're not as effective. The physical activity message isn't as effective as we want it to be. And this is often, for many, credible, trusted sources. Lastly then, sport and physical activity opportunities. So how can we better support people to be active in a way that's right for their individual circumstance? And this column has changed quite a few times because we end up talking about the sport and physical activity sector, and we forget about a lot of the self-directed activity, unsupervised activity that people do. One of the highest things in terms of activity types people do in this country is walking and cycling, as well as fitness activities and things within their own home. So that's why we were just really clear here that we're not just talking about structured, formal, supervised activity. This is about getting people to move more in a way that's right for them and their condition. Lastly, those arrows there are the interaction between the health system, health sector, and the sport and physical activity sector. And at the moment, it's fair to say that it's not seamless. When individuals are recommended, referred, prescribed into activity, it's not always a seamless journey. There are friction points that make it a little bit harder. And when we're thinking about those barriers for the individual themselves, that's going to only make things worse if we don't make things easy and simple for people. So that's the current position that we're in. And just to give you a couple of examples of these kind of misconceptions that we need to start to challenge to bring it to life, and it's worth saying here that this is for illustrative purposes, we have come across through our work some very ingrained thoughts about exercise and people with health conditions. And just to say a couple of them, so people living with a health condition should only be signposted into condition-specific exercise. All people living with a health condition should and want to seek expert condition-specific advice before getting active. And we've even set up a system, our qualifications, our structures, messages that reinforce these very assumptions. So we've got to this point now where we feel like we need to really start to change how we think and respond to these challenges, and challenge the status quo. So just to go into a bit of a deep dive on one area we felt was a really big opportunity for change, and that was working with healthcare professionals. There are, I think, stats vary, but at least 600,000 healthcare professionals in the country, and 1 in 10 people visiting GP every week, 1.2 million people visiting a pharmacy every single day for health reasons, and for many, healthcare professionals are the trusted voice. But unfortunately, the reality is physical activity is not part of the medical curriculum in a really meaningful way. For example, in a more recent survey, over half the GPs admitted to having no specific training on physical activity. Secondly, then our CMO physical activity guidelines, only 1 in 5 in a recent survey were broadly or very familiar with the physical activity guidelines. And that's not just limited to GPs, so there was also a recent study done with physios, and we've got Anna here today, which showed that only 16% knew all 3 elements of the CMO guide, physical activity guidelines as well. Healthcare professionals do not feel confident discussing physical activity. So again, in the survey, only 44% were confident in actually raising physical activity, and I'll talk a little bit more about that in a moment. So it's therefore not particularly surprising that it's not yet the norm. It's not something that is the go-to at the moment. Physical activity is being underused. So that's why we're working with Public Health England and other partners to support healthcare professionals to increase their awareness, skills, improve their confidence in having the ability to raise physical activity on a day-to-day basis, and incorporating it into a clinical practice. The programme's been designed based on where we think the big opportunities are. So it's looked across training, looking at both primary and secondary care. Looking at influence in the curriculum, so thinking about all those healthcare professionals that are actually being trained at the moment. looking at postgrad education, and also a bit of a big focus on continuing professional development as well. So that's again a mix of online resources, face-to-face training, primary and secondary care, testing areas where we need further development or evidence-based, and also looking at it from two lenses. So what are the national resources that everybody should be able to access, and also testing a number of things in local places as well. So thinking through, much like the example we've just had, how can we incorporate and embed within a place, considering the very complex health landscape. So I won't attempt to describe all of the areas of the programme, but just to give you a flavour, so our clinical champion training is peer-to-peer training from healthcare professionals around physical activity, who then deliver cascade training, so they deliver more physical activity, more of their peers across the country. And the second one, which I'm going to go into more detail, is moving medicine. So the moving medicine was developed by the Faculty of Sport and Exercise Medicine, who've already been mentioned this morning. They were asked to develop a clinician-facing resource on physical activity in the treatment and management of clinical conditions. And this was in response to the fact that many healthcare professionals know and recognise the importance of physical activity, but felt that the conversations weren't particularly rewarding. So often they felt they raised it, and sometimes it would even get to a point where it felt like conflict with the patient. It wasn't considered a priority, particularly with the limited amount of time that healthcare professionals have with a patient, and felt that they lacked the confidence and had no system support as well. So this is online. This is a website that you can access. It was launched by Matt Hancock, our Secretary of State for Health and Social Care, in October last year. It's already had 26,500 visitors, and we've had a lot of international interest in the resource as well. The topics on the online resource are very broad. The most viewed topics are MSK, cancer and depression, and you also might be interested to see what's under development as well. So how was it developed? The faculty did an excellent job. They developed it using a knowledge interaction framework with over 300 professionals. So they looked at what the evidence base was out there, and they consulted with professional bodies, expert partners, health charities, to really understand what the evidence base was and distill it into something that was then a usable tool for individuals. So there's a list of all conditions. There's things like how do you actually raise physical activity, some more of the kind of behaviour change support elements, and looks at how can you raise it within 1 minute, 5 minutes, 10 minutes, understanding that there's obviously going to be a variable in terms of the amount of time that's available. It combines the evidence base for physical activity and the behaviour change element so that we can improve the quality of the conversations that are being had between the healthcare professional and the patient. So when I say it was developed with lots of partners, everyone loves slides with lots of logos on, don't they? You always get one. So this is the whole range of partners that were worked with to develop the website. As I mentioned, it's a whole range from professional bodies through to Royal Colleges. So I'd really encourage you to have a look at that website, and hopefully there's something on there that would be of use to you or others. Another partnership I just wanted to share very briefly is that with the Royal College of General Practitioners. So this is a membership body of 52,000 GPs. We have with them, and it is live, but officially launching this week or next week. It's still to be confirmed. But it's a physical activity and lifestyle toolkit for practices. We are encouraging and working with them to encourage practices to share best practice amongst each other, and that's looking at everything from how they embed physical activity into the practice, looking at how you can evaluate and consider and share patient outcomes and how you get the most effective patient outcomes, providing PD opportunities through webinars, podcasts, promoting moving medicine, which is a free resource, and also the launch of a active practice charter. So this is an accreditation system, so active practices will be rewarded and recognised when they are meeting 5 pillars, which include things like increasing the physical activity levels of staff members, increasing physical activity levels of patients, and also partnering with local opportunities as well, such as parkrun or Walking for Health. So going back to the 3 big challenges that I mentioned earlier, just wanted to share a very exciting piece of work we've been working on for the last couple of years, which is really looking at that first column, but we hope it will also have a ripple effect on the other areas as well, which is around messaging. So it's felt that at the moment there isn't a unified message around physical activity coming from health charities. So we have been working with a collaboration of 16 of the leading health and social care charities. They represent the 50 million people in England that are living with or are at risk of developing a health condition. They have significant reach. They are trusted, recognised, credible charities. And we will be launching in September, alongside and fronted by, I should say, the charities, a national campaign to support those with long-term conditions to get active and challenge that misconception that it's not for them. So watch this space for that in September. It will be on your TVs, and we're if any of you are familiar with our This Girl Can campaign, we are pitching it at the same level as that in terms of scale. So watch your space. Thank you very much.
Nick Majerison here. Thanks for listening to Top Med Talk. Now, before we let you go, it's important that we remind you to subscribe to Top Med Talk. That way you'll never, ever miss another episode. Also, if we could encourage you to join us on social media, Twitter, Facebook, LinkedIn, YouTube, pretty much every single social media platform, we're there. Join us. And finally, check out topmedtalk.com. If you go to our website, you can subscribe to email updates. That way we can always tell you where we're going to be, what we're going to be doing, and how you can join us. topmedtalk.com, and click on the section marked email updates. Finally, Top Med Talk is proud to act as the broadcasting arm of EBPOM, Evidence-Based Perioperative Medicine. We'd love you to find out more about them as well. ebpom.org is their website. That's ebpom.org. And if you go to ebpom.org/meetings, you can find out about some of the wonderful meetings that we attend and cover across the year here on Top Med Talk. That's ebpom.org/meetings.